So I would like to thank the sages for the opportunity to present our work today. So we have nothing to disclose. So wait and see strategy had been recommended in clinical complete responder after chemoradiation for esophageal cancer patient. Endoscopy is a key clinical tool for local disease detection after chemoradiation. However, the incidence of local regional recurrence was high, and when detected, it's too late for salvage surgery. So we hypothesize that the significant number of the patients who achieve clinical complete response with negative endoscopy after chemoradiation may have microresidual disease left undetected. So our aim was to investigate the incidence of the residual disease in the resected specimen and the outcome of the planned esophagectomy in esophageal cancer patients who achieve endoscopic CR after chemoradiation. So here's our protocol. We have 67 patients with locally advanced squamous cell esophageal cancer. All of them had feeding jejunostomy before chemoradiation. 3 months after completion of the chemoradiation, our patient had researching workup with EGD, CT, and some had PET scan. 52 patients achieved endoscopic CR. 1 patient refused surgery, so we have total 51 patients underwent esophagectomy. So here is the characteristics of our patients. Basically, they were advanced disease. So 63% had tumor length more than 7 centimeters, and 71% had clinical nodal positive. So of 51 patients with endoscopic CR, 43% had PCR, and 57% had residual cancer cell in the resected specimen. Of the 29 patients with residual disease, 8 patients had disease confined only to the lymph node. So to analyze the location of the residual disease in the resected specimen, we measure the distance between the luminal surface to the most superficial viable cancer cell in the wall of the esophagus in each patient. And we classify all these specimens according to the TRG system. So here's a picture of the distance between the luminal surface to the most superficial cancer cell in each patient according to the TRG. So basically, about 50% of the residual cancer cell confined to the mucosal and the submucosal area. On the other hand, the other 50% of the residual cancer cell located outside the mucosal and submucosal area, and they were unlikely to be detected by endoscopic biopsies. So overall morbidity in our series is about 40% and 2% mortality, and almost 90% had R0 resection. 5-year survival was 32% and 60% for local regional control. Patients who achieved PCR were significantly better in terms of overall survival compared to those without. And PCR had better survival than patients who achieved endoscopic CR. So endoscopic complete response is not a reliable marker for the PCR. So in conclusion, in locally advanced squamous cell esophageal cancer treated with neoadjuvant chemoradiation, microresidual disease may left undetected in esophageal wall or lymph node in approximately about 50% in patients who achieve endoscopic CR. So intensive surveillance with endoscopy and biopsies may not be effective after chemoradiation. So planned esophagectomy should be an option in all physically fit patients. Thank you very much.
Any questions? Please identify yourself if you're coming up to the mic. While somebody is coming up, a question for you. Please,
Yes,
Gary.
Stephen Bowers from Jacksonville. Patients who are going to get definitive chemoradiation for squamous cancer would get an additional radiation boost after the standard cross regimen, we would imagine. Did you account for that? And do you think that there would be an additional number of negative patients or patients who had a complete response with an additional radiation boost? Thank you.
So unfortunately, we didn't do that. Sorry.
Do you have any thoughts on?
Yeah, one quick question. This was all for squamous cell carcinoma. Any plans to look into adenocarcinoma of the esophagus?
So no, in our country, the incidence of adenocarcinoma is very low, so we exclude of this patient. So normally we give, if we had patient with the adenocarcinoma, we usually prefer the preoperative chemotherapy more than the chemoradiation in that patient.
Thank you again.